Greetings, Zimbabwe, Africa, and the world. Welcome to In Conversation with Trevor, brought to you by Titan Law. I go beyond the headlines and beyond the sensational. Today, I'm in conversation with Dr. Riitta Dhlodlo, Busisa Moyo, Nkosana Mazibisa, who are representatives of a multi-stakeholder organization called I Am for Bulawayo Fighting COVID. I hope you find the conversation instructive. Welcome to In Conversation with Trevor, to the three of you. Starting off with Dr. Riitta Dhlodlo. Dr. Richard Ludlow, you are a public health specialist with special interest in tuberculosis. Busisa Moyo, who is the CEO of United Refineries, the chairperson of Zimbabwe Trade Fair, and also the chairperson of ZIDA. I suppose, Busisa, congratulations for your recent appointments to both the ZIDA board and the Trade Fair board. Congratulations.
Thank you, Trevor.
And welcome to Nkosana Mazibisa. Nkosana, you are an international award-winning social entrepreneur. You are a 2016 Mandela Washington alumni, and you're pretty active with young people getting involved in business. So welcome to you all. We are discussing a very noble project that you've all started, which is called I Am for Bulawayo Fighting for COVID. Nkosana, before we started, you were sharing with us the difficulties that you've had getting to where you are right now. Explain to us what happened, which is basically the impact of the lockdown on all of us. What happened to you, Nkosana?
Thank you, Trevor, for the conversation. I am Nkosana Mazibisa. I am part of the comms cluster. I lead on community participation and mobilization. So today we're the food distribution, which is a walkable distance from my place. So we're the discussion with the local leadership, iron out some few issues so that the food distribution goes well. So after that discussion, I went back home for a connection regarding this conversation. As I was doing sound check, Zesa went off. So then I was forced to look for an alternative place, which is the city center. As I left home coming to town, there was no transport. I had my papers to come to town, but there was no transport.
Yeah.
Eventually, I had to recharge Omar Laicha, which are famously known as that. As we got into town, the police stopped us and they said, Omar Laicha, they don't have the particular papers. I was the only one with the papers. They had no papers. So it was more of a cat and mouse situation until Dr. Lindwe came in and rescued us from that. I left them there. Eventually, I am here. So those are one of the challenges that we are facing during lockdown. Convenience is not there anymore.
Thank you, Nkosana, for sharing that story. Dr. Dhlodlo, what has been the impact of the lockdown on you personally, the business that you are involved in?
Thank you, Trevor. Good afternoon, everybody. I think the lockdown has had a huge impact on my family and me because we are now much limited regarding the movements. We spend most of the days in the confines of our home. We do that, of course, with discipline, and we feel the responsibility for doing that because we do appreciate that it's for our own interest, for our own best. But still, it's difficult. I have also been stopped by the police a few times, but I have managed to get through with the papers and with a few smiles and explanation that I'm looking for my groceries from a shop just behind the corner. And work-wise, I think that COVID at the moment swallows so much of everybody's time working in health. I'm been privileged to have been invited to volunteer also for I Am for Bulawayo Fighting COVID team. and I work and assist the cluster in health and in our health response. Regarding my union work, indeed, as an organization, we are very concerned what is happening to persons with tuberculosis, and especially those ones who may not have been diagnosed by now. They may have delays in diagnosis, difficulties in getting diagnosed because a lot of health facilities are not functioning completely normally at the moment. So I would say that even though I think I'm in support of the extended lockdown in Zimbabwe, it has had a lot of impact on our lives, just like probably every resident's life and citizen's life in the country.
Absolutely. Busisa, as CEO of United Refineries, first of all, and also in your own personal capacity, what's been the impact of the COVID-19 lockdown on you and the business?
Well, thank you, Trevor. The lockdown has had multifaceted impact. First of all, getting workers here has been a great challenge. Nkosana was highlighting the issue of transport. We've had to organize transport separately for our workers to get here to the factory. We are in essential services. We produce food and we produce soap. And so these are essentials. The challenge has been getting the raw materials here, whether it's soybean from Kwekwe, getting it offloaded, packaging from Harare. You know, so the supply chain has been disrupted quite significantly. And so while we have remained open, it has been more difficult than what we've seen in a normal sort of operating environment. We've also changed the way we work for physical distancing. To just yesterday, we sent all our workers who are over the age of 60, we sent them home. Anyone with tuberculosis or pulmonary condition or lung-related condition, we've sent them home. And we are just remaining with those under 60 that have stayed at work. So we've had to make changes. And you can imagine on a production line, that's quite disruptive because you know, some of our most experienced operators around about that age group, but it's also made us think, you know, of what we need to prepare for as we face this COVID pandemic. And it's been an important decision for us because we want our most vulnerable workers protected, because we don't want loss of life while we are in essential service. So these are some of the interventions besides putting extra sinks for people to wash their hands more often, making them more visible in certain areas like the production filling lines where there's quite a lot of people in one room. They have to wear masks now. So these are some of the interventions that we've had to make sure that we reduce the rate of infection, especially at the factory, and limiting visitors as well to the premises.
Wow, our lives have changed in a huge way, and one wonders whether life will ever be back to what it used to be. Busisa, let's get into the project, the noble project that the three of you are involved in, plus other colleagues. And the project is called I Am for Bulawayo Fighting COVID-19. In the first instance, Busisa, what motivated the group of you to get together and say, let's do this? Point number one. Point number two, who is involved in this multi-stakeholder coalition that you've put together?
Thank you very much, Trevor. So at a national level, we had a group called Business Fighting COVID. This was made up of CEOs around the country who saw the need for non-state actors to respond, in particular business. And we started on that group, and I'm still on that national platform, which is Business Fighting COVID. I was in that platform a representative for Bulawayo. But as we progressed, we realized that, you know, various places in the country have certain peculiarities, and those peculiarities need a tailored solution. For example, Bulawayo has 2 referral hospitals here. Bulawayo has Egusileni, a hospital built by Harvard Business School sometime in the late 90s, Thorngrove Hospital. So very peculiar a set of circumstances. And we saw the need to tailor and localize a response. And that's where we ended up saying, let's formally structure this into a Bulawayo initiative, working with people in Bulawayo, healthcare professionals like my esteemed colleague, Dr. Riitta Dhlodlo, who's very humble but very experienced in the health sector. There are others like Dr. Dixon, Dr. Wedu Ndebele, and many other CEOs of the hospitals. We recently had a provincial medical director appointed who's part of our group, and we are working to support him. So this multi-stakeholder platform of non-state actors, essentially, Trevor, responding to the call by government to participate and contribute, whether it's resources, money, time, to, in responding to this COVID pandemic, because Bulawayo, again, as I said, has a peculiar, it's a root center. We are connected to Botswana, we are connected to South Africa directly. A lot of traffic that comes through. When people want to go to Gwanda, from Botswana to Gwanda, they will come through here. When they want to come from South Africa to Plumtree or to the Falls or to Hwange, they will come through Bulawayo. So it's a root city. And that presents a certain vulnerability to infections from hotspots like South Africa, which is, has a high rate of infection, a high number of cases at the moment. So that's what led to us looking at Bulawayo's unique position and responding using this collective of health professionals, business, churches, religious groups, and other well-wishers. The diaspora has been absolutely phenomenal. In our group, Trevor, we have a young lady sitting in Brussels, Nomsa Ndebele, who's done all our artwork. The artwork, the logo for this initiative was designed by this young lady, Nomsa Ndebele, who's sitting in Brussels. So the beauty of technology and things like the Zoom technology we are using is that we can get everyone involved and get really the best minds to respond appropriately to this initiative.
Right, and going to Nkosana Mazibisa, International Award winning social entrepreneur, and congratulations, I see you've just published a book. Wishing you all the best with that book. Exciting to see a young person like you getting involved in a project of this nature. Share with me what got you involved in the project, Nkosana.
Thanks a lot, Trevor. One thing I like about the initiative is that it's very inclusive. We cannot fight COVID-19 without including young people who form 60% of the mainstream of the population. And one of my favorite quotes is that what nobler employment is there other than of a man who instructs a rising generation?
Oh, yeah.
So for us to have a better country, we start rebuilding it now by involving young people to learn that leadership is not always about position. It's always about influence. In our small spheres, be it church, be it work, be it school, are we able to close gap, work collectively together against one common enemy? In this current stage, it's COVID-19, which does not know any color or creed. So as a young person, I felt it's very important for me to be part of the movement as well. So I fall under the communications cluster, leading on community mobilization and participation. As long as there's no community mobilization and participation, then we're not able to deal with the COVID-19 issue.
Tell me, Nkosana, what's been the response of the young people, one, to your involvement, and secondly, to the entire initiative?
Their involvement has been phenomenal. It's so positive. I attribute this, Gakuli, to the leadership of the initiative. The fact that we're inclusive, we're open, and we're very positive. You may have the best of the best ideas, but as long as you do not know how to harness social circles, then your idea won't move fast. So young people have come on board. For example, I can give you a quick number. We have Bukhosi and the Highlanders. We have Butolezo Khotsi, the regional director for Art Gallery.
We have Job Ngwenya, who's an educator, young person, Tony Elumelo Fellow. We have quite a number of young people who have come on board. Others may not be doing videos. Others are behind the scenes doing graphic designs. Others are doing the video editing. It's because they are contributing their skill towards this so that there is information dissemination. What's critical is information dissemination to all communities, and young people are taking cognizance of that.
Right, that's inspiring and great to hear. I'm hoping that your involvement and your role in this is going to inspire more young people to come in and participate in whatever role the initiative calls upon them to do. Busisa, you raise an issue which some of us, sort of tend to forget, and that is, to a very large extent, Bulawayo is a hub. Do you think that's the reason why it's looking like Bulawayo is the epicenter of the pandemic at the moment?
Trevor, it's an emphatic yes. I think that we have, I'll give you an example. Just yesterday, we had 500 people deported from Botswana. Plumtree couldn't keep all those people, that volume of people. They've had to come here. We had another group earlier coming out of South Africa. That's also being quarantined here in the city. So, and besides our diaspora, a lot of our young people, because Trevor, Bulawayo, has been, I want to use the word isolated for a long time and has gone through deindustrialization. A lot of our young people are working in restaurants in South Africa. When South Africa locks down, they make their way home because they cannot stay in South Africa. They have to, and I know there was a rush for the border because we move goods using Beitbridge border. And soon after the South Africa lockdown, in fact, when it was announced, if you remember, it was announced on a weekend, but targeting sort of a Thursday. And those 4 days were an absolute nightmare at Beitbridge. And my assumption is that a lot of the young people were coming back home. So this creates a lot of vulnerabilities for Bulawayo. As you've correctly pointed out, it is a hub, and we are seeing the number of cases in the city, but it is also not well equipped to handle that because of deindustrialization, because of years of being isolated for various reasons. We find ourselves in a position where we have to respond and come together. The other thing, Trevor, is that Bulawayo is a referral center for a whole region. The southern part of Zimbabwe, Masvingo refers people to here when they cannot handle cases. Gweru refers people, Plumtree, Wange, Victoria Falls, when the cases get to a certain level, they look to Bulawayo. So I'm for Bulawayo is a really doing another thing in our social psyche to get us primed that we have a leadership role for a whole sub-region of Zimbabwe. And those who are joining us to support us are not just supporting Bulawayo, they are supporting really the southern parts of the country, which have immense challenges in terms of resourcing, staffing, equipment, and so on.
So clearly, like Busisa has outlined, Bulawayo right now looks like it's the epicenter. Dr. Dhlodlo, let me cross over to you right now regarding the processes that we have observed being key in terms of flattening the curve, rather. That is testing, tracing, and treatment and isolation. If you could talk to us about that in as brief as possible, your testing capacity in Bulawayo, the tracing and the treatment and the isolation centers that you've put in place.
Thank you, Trevor. Those items that you have listed form indeed the core functions of the public health response to any disease outbreak, and in this case to the COVID outbreak. Ministry of Health and Child Care publishes daily reports, and as of yesterday's report, a total of 4,159 tests have been carried out all throughout the country. And just within the 24-hour period from 20th to the 21st of April, 841 tests were done, again nationwide. I would like to highlight that in Bulawayo, a total of over 200 of these 841 tests were done. And that was the largest number in any locality, in any province. So as we are a hub and many roads, many referral routes within the southern region lead to Bulawayo, I think the city is ready to attend to persons who are suspected to have COVID and who need testing and whose contacts need to be line listed, traced and screened and possibly tested. I think all of us, including our viewers and listeners, are interested to know what are then the results of all this testing. So far, the number of laboratory confirmed cases in Bulawayo remain at 10 cases. In Matabeleland North, we have got one confirmed case, a person who has since recovered very well. We have got 4 cases. That is very good news. And we have 4 cases in Mashonaland East. And the number of cases that has increased nationwide are the new three new diagnoses done in Harare. The details of these persons are still awaited. So Harare now has reported 13 cases all in all. That is 28 cases in the country, of whom 3 persons have died, I'm sorry to mention. And just as we were preparing for this conversation with you, Trevor, sad news of yet another death having occurred in Harare reached us. We have no details. It appears that this person has been attending a private hospital. I would actually like to take this opportunity to appeal to the private providers, who are of course very much required to come and assist the ministries and public health sector's response to this outbreak, to liaise with the ministry and share both the number of tests done, tests that were positive, as well as their statistics on cases of persons who may have died. This is of fundamental importance, otherwise we will not know as Zimbabwe what is really happening in the country. And I want to emphasize once more that one death, one person out of the 3 Zimbabweans who have died, unfortunately was lost here in Bulawayo in a private hospital. And this person and this case was appropriately immediately reported to the authorities. So I really appeal for private-public partnership during these times of preparation. And as we are learning to manage this outbreak better and better, and it means that really private sector has to come to the game and work together with health authorities, be they health services authorities in the cities, and then ministry on the whole.
Let's talk now, Riitta. Let me move you to tracing. We've spoken about Bulawayo being a hub, and you can see people coming from, the pictures that we saw when the lockdown was announced in South Africa of Zimbabweans coming back home. Those were frightening pictures. And one would assume that there's people coming from Botswana, people coming from Midlands and so forth coming to Bulawayo. What's the capacity as far as tracing, contact tracing is concerned, specifically for the Bulawayo area? Are you happy with that, or the provinces around Bulawayo that feed into Bulawayo?
Thank you. That's a key question. The persons who have been made to leave the countries of their residence or who have wanted to return back home are at the moment quarantined in various state institutions. And it's an activity where the provincial resident ministers play a key role. Health Services Department of Bulawayo City Council assists the resident minister in this task. It's fairly easy because these persons have, they are located in one and the same address or several addresses, various institutions such as Bulawayo Polytechnic, Hillside Teachers College, and possibly Elangeni Training Center.
Okay.
Talking about persons coming from, should I say, normal residential areas, people who haven't been deported or who haven't come on their own accord back to the country, I think that the Health Services Department has very good capacity and competencies in this regard, because remember, they have the primary responsibility for providing tuberculosis services in the city. And this program functions very well, and contact management is one of the key cornerstone services provided within TB control activities. Health Services Department at the moment has 5 rapid response teams who are the frontline people working and doing this work, and they also collect the specimens from persons whom they have screened and assessed and found needing the test. I'm pleased to mention that this department has also recently as last week, trained teams at Mpilo Central Hospital as well as the United Bulawayo Hospitals, for the hospitals to have capacity to do the very same testing, so that the rapid response teams don't need to visit the hospitals. And if there are persons with positive results from the hospitals and they reside within the city of Bulawayo, then again the team will do the contact listing and contact investigations. Thank you.
Just to for the viewers at home who'll be seeing Nkosana Mazibisa's picture flashing in and out, we are having technological challenges, and he's trying to dial in, and hopefully he joins us later on because it's an important part of this conversation. Let me turn to you now, Busisa. In terms of the infrastructure and the facilities that you have identified for Bulawayo fighting COVID-19 is going to need, and what has informed that looking at the facilities that might come in handy?
Thank you, Trevor. So we are supporting the direction of government because all facilities, as you know, as a result of the state of emergency, all health facilities are now under the control of central government. So we are taking a cue from those facilities that they have identified as COVID isolation and treatment centers.
Right.
But it is a consultative process because there is a task force. Colleagues that are listening in will know that there is a ministerial task force at a national level that is chaired by the Vice President of the Republic of Zimbabwe, Skembo Mohadi. And underneath there are ministers. And the ministers have been assigned to various regions and provinces in the country. The person assigned to Bulawayo is Minister July Moyo.
Okay.
Who we've got a direct line to, and we've been discussing about which facilities. And at the moment, Trevor, the facility that's been identified, there are 2 that have been earmarked for COVID treatment and isolation centers for the severe cases. It's right. Thorngrove Hospital and Ebusileni Medical Center. Thorngrove is a hospital that's under Bulawayo City Council and under the control of Bulawayo City Council. It is an infectious diseases hospital that's been designed that way. However, it has gone through years of challenges, neglect, and the infrastructure is run down. Private sector, private individuals under this initiative, I Am for Bulawayo Fighting COVID, have come to support in various ways, from painting to linen to geysers. Yesterday, we had a donation of 2 solar geysers from Electrosales. This is what private sector is doing, looking at all these institutions. The second one is Ebusileni Joshua Mkabu Hospital. That is a hospital that was built in the late 90s, Trevor, and it has basically, it's a shell. There is nothing in there. There are no beds. There is no furniture in there. It was built, but it was never used. Somebody leased it for a few months, and that's all. beautiful facility. It has the capacity to take 200 beds. And that is what we are looking at.
Okay.
We want to put 200 beds in there and to equip, to get it oxygen ready, because oxygen is critical in fighting severe cases for COVID. So those are the two facilities. We have a conversation, Trevor, that is going on with regards to UBH.
Okay.
Bulawayo, according to projections that have been done by Riitta and her colleagues in the medical profession, they show us that we will need at peak, if we go the route of New York or Italy, we are going to require at peak 600 to 700 beds in the city for severe cases. That's at peak.
So that's the peak.
So that's the peak.
Right.
And as we go, so we are starting to say, okay, Thorngrove can take 50 beds, Egusileni 200, that's 250. If we have more cases, where are they going to go? So the conversation right now, where it's at, is to say, let's have UBH, United Bulawayo Hospitals, as a backstop, as a fallback measure in case these cases. All the other non-COVID patients are going to be evacuated, maybe taken to another facility, probably Mpilo, and then that will be free to accommodate COVID positive patients. That's the thinking around facilities at the moment. The churches, Trevor, have also come forward and said they are offering their churches to be converted under the direction of the CDC to say they be turned into isolation centers for mild cases. Because in Africa, a lot of people live in one-room houses. They cannot isolate at home. So we need facilities that can house these people for a time. They are cleared, then they can be reunited with their families. So that is the total facility panoramic view, Trevor, and I'm summarizing it here. Okay. We also have smaller things like the caregivers in this initiative at Egusileni and Thorngrove should also be housed somewhere before they go to be with their families, because as we get into winter, this COVID-19 impact in Bulawayo is likely to be seen at higher levels, and we need to be ready, and we are preparing the city as best as we can. So we will have nurses maybe going into United College of Education or Hillside Teachers College, being quarantined there before they are reunited with their families. That is the latest thinking on that.
That's a huge challenge there, Busisa, and it's uplifting to see that in working in collaboration with government, infrastructure is being put in place. Working in collaboration with the local government, infrastructure is being put in place. Richard, you did indicate, I mean, you are a specialist in tuberculosis, that there's a concern around that. Are there any issues that we should be worried about people suffering from tuberculosis during this particular time?
Thank you. There are some tuberculosis patients who are undergoing their treatment at the moment. And I'm aware that health services all throughout the country, not only in Bulawayo, have made arrangements for patients to have their medication with them at their homes for longer periods than usual. It means that they will get less health worker support, but we trust that patients who know that they have TB will cope, and they will be able to complete their 6 months treatment if they have drug-susceptible tuberculosis. My concerns pertain to persons out there in the community who have not been diagnosed, who may be falling sick. And there is overlap between symptoms of COVID, which is mainly a respiratory illness with some fever, dry cough, sore throat, difficulty in breathing, and loss of smell and taste in many, many cases. More or less the same symptoms that tuberculosis may have. So there will be probably challenges in getting the right diagnosis, unless, again, our frontline health workers are fully aware of the overlap that exists, and that they are sufficiently capacitated so that they can think of both conditions and possibly also other conditions that continue to run in parallel even during the pandemic times. I'm talking about ordinary common colds, seasonal flus. Seasonal flu is coming up during the cooler months of those that are just ahead of us, as Busisa has mentioned. And of course, there are individuals who develop asthma, other conditions with difficulty in breathing or chest infections.
I mean, Busisa has already touched on the fact of, I'm imagining the difficulty of, Riitta, social distancing in a place like Makokova and others. Are you concerned that the numbers that we're talking about here might not actually be representative of what we might end up with, let's say, after the 14-day extension of the lockdown?
Thank you. If only all of us had the crystal ball to look what happens, and a ball that will tell us how long ideally the lockdown should be, etc., etc. It has been said and estimated that our outbreak may not have even actually started. It may come only towards the end of May, early June, and thereabouts. So you mentioned the term flattening of the curve. We're talking about the epidemic curve, which means number of cases on a given date. And it remains rather flat in Zimbabwe. We are very grateful for that because it gives us time to get ready, at least in 2 or 3 aspects, such as being ready regarding the facilities, something that Busisa has just mentioned, for us to be very, very fast and efficient regarding the public health measures, that is the contact investigations and expanding testing, and the so-called social distancing or physical distancing is one of those messages that we wish to put across to the communities and appeal to their ideas regarding how if I live in Makokova or if I live in Pumula South, how I can, in my circumstances, best observe physical distancing. I believe it can be done, and I wish Nkosana will be able to log in. We have experience from many, many parts of the world, including Sub-Saharan Africa and Zimbabwe, that when members of communities have the facts and they know why something should be done, we can then together work out the how it can be done in these circumstances. So
Riitta, I want to press you on that point because that's hugely important. The fact that we've had a top-down kind of model, and what you're saying is that as far as physical distancing in places like Mbare and Makokova, perhaps there ought to be a conversation from the top, from the bottom rather upwards, in terms of asking the communities, what's the best way of physical distancing? What do you think, Riitta?
I'm 100% with you. I don't think that in the 21st century, health education messages should be messages that start with the words, English words, do this, don't do that. I think they should be messages that are much, much more nuanced and that are formulated in such a way that they are feasible and appreciated by the communities. And Nkosana is definitely one of the sort of link persons who can work together with health services providers, with PVOs or trusts like ours. I am for Bulawayo fighting COVID, and I would like to bring in the other authorities, like the police, etc., a little bit later on. So at least here in Bulawayo, we have always worked through our local government representatives, that's the councillors and the mayor, the residents association, as well as the health staff. And at the time of an outbreak, a major threat like COVID-19, I think we can bring in a number of the other important community leaders and opinion leaders in our societies. I think we do know who they are. And it's very important that we reason with people. That's my experience. That's why I'm also very confident that tuberculosis patients who have had the benefit of interaction over several weeks and sometimes months, because remember the treatment takes minimum of 6 months with health workers, that everybody is responsible for their own health. Everybody wants to get better. Nobody wants to die, especially not from a curable disease such as tuberculosis. So I have my complete confidence that if we are able to communicate in meaningful manners with communities, good things will come out of this. And physical distancing, it's doable in many settings in my thinking, as long as we appreciate the context-specific issues. Perhaps Busisa, you wish to come in this as well.
Yeah,
and then we can talk about hand washing in a situation where water is short.
Absolutely. Right. Riitta, before Busisa jumps in, Busisa, you jump in just now. I mean, I've been concerned, Riitta, when I see queues of people outside shops waiting for meal, waiting for cooking oil and so forth. And I'm like, that surely is not how we should do it. Am I reading things wrongly, Riitta?
Oh, I think you have witnessed the very same cues that Busisa and I and a number of our colleagues have seen, and I think all of us are very concerned. I think my interpretation is that people in those queues who, against their better information and knowledge, crowd the areas are doing that because it's a little bit of a question like, am I going to get the meal or not? So during these sort of times, I would look at the manufacturing sector, perhaps even government, to ensure that basic commodities are not in short supply, so that people can indeed do what they want to do. Busisa, I think you represent
Busisa, do you want to jump in?
We are talking about.
Yes, I think Riitta is right in a lot of ways, Trevor.